Hi.
Hello everyone. Greg Sommer, co-founder of Trak Fertility, joined again by Dr. Serena Chen. We're coming live from ASRM in beautiful San Antonio, Texas. Do your intro again, one more time.
Okay, Dr. Serena Chen, Serena H. Chen at the Institute for Reproductive Medicine and Science at St. Barnabas in Livingston, New Jersey.
What's the website?
It's sbivf.com.
Yeah.
And you can follow me on social media, Dr. Serena H. Chen.
Oh, there you go. Yeah. She's one of the top experts in the field amongst all these luminaries here at the conference. So we're really grateful to get your time, and thank you for joining us. And we're just cranking out a bunch of videos.
Yeah.
Thank you. So we wanted to talk about something that doesn't get a whole lot of attention, but it's starting to become a bigger issue, and that's cancer diagnosis and fertility preservation. And
yes.
You know a lot more about this than I do, so I'll let you.
So some people call this oncofertility because it's cancer plus fertility. And I think millions we're now seeing, because we're getting so good at curing cancer, now we're seeing millions and millions of people living in the United States today are cancer survivors. Some childhood cancer, some adult cancers, and now that so many people are surviving their cancer, we're feeling like we need to start focusing on thriving after cancer, quality of life after cancer. And one of the most important things that cancer patients tell us about quality of life is that they want to have families after cancer. And of course, cancer itself and the treatment for cancer can often have a huge negative impact on both male and female fertility. So that's what we just feel like it's important for you to be aware of that. Hopefully you never get cancer, but you probably know somebody who, or at some point, will have a diagnosis for cancer, and these questions will come up, like, am I going to survive? And the second question is often, will I have the life that I always pictured having? And for many people, men and women, that means having a family.
Well, that probably gets traditionally kind of overlooked, right? Because you get that cancer diagnosis. Like, I imagine it's devastating, and the last thing you're thinking about is the future and kids. But you're right that cancer isn't necessarily the prognosis that it used to be, and there's a lot of hope, and to be able to think and put a plan together about how you're going to not only tackle the cancer issue, but go on with your life once you've beat this horrific disease is important, and something that everybody should be educated on early.
Absolutely. And so if you know somebody who's been diagnosed with cancer and they're wrestling with that, it's important for everybody with the diagnosis of cancer who might want to have a family in the future, or even if they don't know, but just wants to leave the door open, just to have a conversation about it. And we can through our websites can of course connect you with a provider that can help you with that conversation. Some national organizations like ASRM.org. We're at the American Society for Reproductive Medicine meeting today. Resolve.org, patient support organization. For guys, freezing sperm is usually very affordable, very quick, very safe, and can make a huge difference for you in terms of having a family in the future. You can really preserve your fertility very, very well through sperm freezing.
And by the way, the technology around freezing and preservation has come a long way too.
Absolutely.
This is very routine. It's proven. It's robust and can work for people.
Absolutely, and it can be quick. It does not have to delay your treatment. And what a lot of people don't realize is, even though egg freezing is more complicated, we're also now happily in that position as well for females. It used to be really tough and difficult and would cause delays, and now we have a lot of data showing that we can do it very quickly without delay and without affecting survival rates or increasing recurrence rates, because and pregnancy in cancer survivors can be safe.
Right.
So we're seeing for both men and women that for at least talking to somebody, at least have a 5-minute or more conversation with somebody about, hey, can I get some more information about this, because I might want to do this, because it can be done quickly and safely for both men and women.
Yeah, have that conversation. It's not at the top of the mind, but it should be considered if you're at that age and want to make sure that you're going to have a successful future after you beat the disease.
Absolutely. And what a lot of cancer patients tell us, because we used to, when we first started out doing a lot of fertility preservation, and we started out worrying that we were going to just be burdening these patients. with too much information and they were going to be overwhelmed. But what we're finding is that actually a lot of cancer patients get a tremendous amount of positive energy and hope from being able to talk about a little bit, at least, about their plans for the future.
Good point.
What, this is what I'm going to do after I survive my cancer. Yeah, this is a beast right now, but let's make those plans for the future. And I think for a lot of our cancer patients, that's actually, instead of being overwhelming, it's actually been kind of an empowering conversation.
Kind of motivating.
Yes, exactly. Yeah. Exactly. And I think our oncologists tell us that having a patient with that mindset is those patients, they tolerate then their cancer treatment better. It's a good thing all around.
Great. Well, thanks.
Thanks
everyone.
Greg.